How would you shortly describe this master's degree program?
Well, this program is designed for global experts and those wanting to understand the global world and what social and healthcare services need and how to innovate in that field.
And how long does usually this program last?
The total is 90 credits, which means that it's about 1.5 years, kind of depending on your pace and what kind of studies you include.
Credits also means like ECTS that is commonly used?
Yes,
Okay.
definitely. So for example, the thesis that the students construct is 30 ECTS, and then the rest is divided into study into courses that are 5 ECTS each.
Talking about thesis and assignments, could you explain a little bit how the models of these courses are divided, or how the students, what can they expect, once coming into SAM and study?
You mean like study modes and
Yeah.
yeah. So mainly these courses are organized online so that we can offer flexibility for those in the working life, and also this international community that we're going to build within this program. And it'll be mostly weekends for teaching, like Fridays and Saturdays, and a lot of independent work or group work. So this is not a typical program where the teacher would just come and lecture and then you would take a test. Instead, you're building from your own working life and your own work experience, and then find developmental tasks and cases where you want to like solve a problem or an issue, and then use the theories that we are teaching and then applying those to the real situation.
And that's very nice in a way, that they can have like time during the week to do other things, if they have family or even work or
Yes.
other activities as well.
Yeah, this program is definitely built for those who are also working while they want to study, and that's why it is mainly done on the weekends, and also why we can keep this work-life focus in it. So we're able to use the work experience and use the real organizations where the students are working, and then take the cases from there, bring them to our community, to the courses, and then apply problem solving there.
And when they write a thesis, for example, can they also use their work experience, even their workplace, perhaps,
Yes.
to write a thesis?
And we actually prefer it that way. So we are strongly emphasizing that they would choose their own commissioning company or organization, preferably where they work at, and find the problem that they want to solve with their thesis, and then go from there.
In what kind of places can the students work, for example, after graduation?
So this program gives you a very strong foundation for managerial positions within the field of social and healthcare services, or for research or innovation or developing the field in general. Even for doctorate degrees if you want to continue with research life.
Well, we heard about the program, the way how the studies can be conducted. But what makes, for example, SAM so special that we want the students to come and study with us?
First of all, SAMC has a very strong foundation and very strong tradition in social and healthcare services. We have been working with these topics since the beginning, and we have a wide range of experts, let's put it that way. And of course, the SAM community, meeting other field students here as well, so kind of getting the network not only from your own field but also from business or technology will definitely help you if you start innovating something new. And then of course the global network that we're building with our partner universities and this huge amount of exchange students that we have and degree students from abroad.
And I can, I've been witness of what you just said. Like personally, I'm not familiar much with the health and care education, but I have heard, around Seinäjoki that our education in healthcare is very good and well known in the country, in Finland, and that is very interesting.
Yes, definitely. I actually have a friend who is a doctor, and studying to his expertise. And he loves to come and work here in Seinäjoki because they say that the hospital here is very good with training new professionals. And I think that also kind of carries into our university. For me, I feel like it's really for us, it's time to step up also to the master level in this field.
It is Seinäjoki and Seinäjoki area a place where students, might picture themselves for the future? Like, do you think there is working possibilities for them after graduation?
Definitely, yes. This area needs international experts to be able to grow and develop. So we're not only building experts to go and take what we are teaching to their home countries, but also offering them the viewpoints and the possibilities to start their life here as well.
Wow, that'll be very interesting. Now, since we need experts, and what about those students who are thinking, actually would like to go to Seinäjoki and Finland and maybe stay and do life? Obviously, we have heard that it's important for them to learn Finnish. Does SEAM provide the opportunity for them to do so if they would like to learn the language?
We do have language classes for our students, and also the city keeps developing different kinds of modes of how to integrate better into our city's life as a person moving from outside. And then, of course, the more you are getting to know Finnish people, the better possibilities you have for learning Finnish as well.
Lastly, do you have any final words that you would like to tell the audience, regarding SEAM or Seinäjoki that would encourage them perhaps to apply and study with us?
So I really just want to encourage everyone who wants to develop their skills in the field of social and healthcare sciences to apply to this program, join our community, come and develop and do something exciting within this field with us.
Thank you. Thank you so much, Elisa.
Thank you.